Have you had a C-section and you're curious if it might be impacting your fertility? Or are you thinking about having a C-section, planning one, and curious if it's going to impact your pregnancy or fertility in the future? This video is for you. Today, I'm going to break down a landmark study from 2018 looking at over 30 million births and how C-section may or may not impact your future fertility. I'm Dr. Lora Shahine, a double board certified OBGYN and reproductive endocrinologist, helping people conceive, build families, and fertility for over 20 years, and I love educating. If this is your first time finding the channel, welcome. I'm so glad you're here. Be sure and subscribe so you get my weekly videos all about reproductive health. And if you're coming back to the channel, welcome back. I'm so glad that you find this information valuable and you wanted to learn more. There are two other ways to stay in touch and learn from me. One is my weekly podcast, the Brave and Curious podcast. Anywhere you listen to podcasts, be sure and follow so you don't miss the weekly episode. And the second is my newsletter. Sign up in the description below. You'll get fertility updates, fertility in the news, and some recommendations that I have about once a week. Cesarean births are common. About 1/3 of all deliveries in Northern America are by C-section. And asking about the impact of C-section on future reproductive health is common from my patients. And I often refer back to an important study published in the PLOS Medicine Journal in 2018. This is a large meta-analysis gathering multiple different studies and observing outcomes from 30 million births, trying to answer these questions that my patients have. If you have a C-section, does that impact your future fertility? If you have a C-section, does that impact the risks or the health of your next pregnancy? The authors Keeg, Norman, and Stock looked to answer these questions with the data that we have in front of us. Now, something that's really important to realize about these studies is that they are observational. You're looking for relationships, does a C-section, which is the exposure, impact future outcomes like time to get pregnant or risks of miscarriage? And the issue is that you're looking for these associations. You can find relationships and look for patterns, but it's not the ideal way to answer a question. If you really want to understand if an intervention impacts a future outcome, the best way to study it statistically is looking at a randomized control trial. The hard part is it's not ethically okay to randomize women who might want to get pregnant in the future to having a C-section or not, and then studying in the future outcomes of the subsequent pregnancy. That is ethically not okay. But we want to be able to answer these questions for our patients. And so observational studies, these meta-analysis, when you can pool lots and lots of outcomes across multiple studies, is currently the best way that we can try to answer these questions for our patients. And as I walk you through the questions and the answers that come up in this landmark study, I'll be sure and explain to you how to interpret the data and what to take away from this really important questions to be answered. So the topics we're going to cover today include the following. Topic number 1, fertility after C-section. Topic number 2, pregnancy risks after C-section. Topic number 3, what risks actually decrease after C-section? So we're looking for these negative impacts maybe in the future, but there are some positive things about having a C-section. Topic number 4, I'll answer some frequently asked questions from my patients. And stick around to the end of the video. Topic number 5 are 3 very important questions I have for you to ask your doctor about your personal situation so you can advocate for your own care. Topic number 1, does having a C-section impact your future fertility? The authors combined data from 11 different studies, which included outcomes from 3.7 million births, and they did find that there was a higher chance of subfertility or taking longer to conceive after a C-section compared to the group of women that had a vaginal birth. In the aggregated data, the authors said there was a 60% higher chance of having infertility after having a C-section compared to having a vaginal birth. Now let's take that statistics into account. And what does it mean? The way the authors present this data is they say the odds ratio is 1.6 with a 95% confidence interval from 1.45 to 1.76. That sounds like jargon. What does that mean? Well, an odds ratio is basically what are the chances of this outcome, meaning infertility, after exposure to something that happened, which was C-section. And they're comparing women that had a C-section to women that had a vaginal birth. And in their subsequent pregnancy, when they're trying to conceive, did it take longer to conceive if they'd had a C-section, or did it take longer to conceive if they had a vaginal birth? And when they say odds ratio of 1.60, that means 60% higher odds of having infertility if you had a C-section compared to a vaginal birth. And then statistically, you want to know, well, okay, if we have this relationship of maybe there's a higher chance of infertility with a C-section. So whenever you're learning about data and statistics and looking at a research study, you could just present the information like 60% higher chance or odds of having infertility after a C-section and really kind of sound the alarm. You really want to know if that information is statistically significant or not. So anytime there's an odds ratio, the authors give a confidence interval, and they give you two numbers. And so in this, they say the confidence interval is between 1.45 and 1.76. Now, if both of those numbers are over 1 and that confidence interval is all over 1, then that is telling you that this is statistically significant. Meaning if they were to look at this over and over and over again, ask the same question with different patients over and over and over again, this 60% increased odds is statistically significant. So if the confidence interval crossed 1, so it went 0.45 to 1.76, and 1 was in the middle there, you would say, this might not be statistically significant. If we were to repeat this information over and over and over again, it might not hold up. So that's a helpful way to look at the data and understand exactly what's being said. What does this mean clinically? Are you going to be infertile if you have a C-section? No, not necessarily. This is a relative risk. It is observational studies. It is looking at a lot of patients. 3.7 million births is a lot of data to look at. And some people will take longer to conceive, but it doesn't necessarily mean that they are going to have infertility, or even if it does take them longer, it doesn't mean that they're going to have to use intervention to try to conceive later. And just remember, these are observational studies. And so there could be a lot of contributing factors to this, like age of the patients, reason that they had a C-section to begin with, lots and lots of information. So you need to gather information, try to answer the question, but also realize that there could be a lot of other factors at play. Remember, association does not necessarily mean causation. Just because there was an association of having a C-section with a longer time to conceiving in your next pregnancy, that doesn't mean that the C-section necessarily caused that to happen. Topic number 2, risks in the subsequent pregnancy. So if you have a C-section, are there risks in the pregnancy that could happen? Again, this is observational data, but the authors looked at a large group, millions of births, and compared outcomes of certain pregnancy risks based on if the patient had had a C-section in the past or a vaginal delivery in the past. We're going to look at 3 specific things: placental previa, placenta accreta, and placental abruption. These are complications in the placenta and complications in the pregnancy. And a curiosity is, if you had a C-section in the past, are you at higher risk of these things happen? The takeaway is yes, but let me share the data. Number 1, a placenta previa is where the placenta actually implants close or even covering the cervix. Now, placenta previa, as the uterus grows, can actually move away from the os, and it might not be an issue with delivery, but some people can have increased chance of bleeding in pregnancy. Some people have an increased risk of early contractions or needing a subsequent C-section, because if the placenta is covering the outward track of the delivery of the baby, you need to deliver by C-section. You cannot deliver vaginally if you have a placenta previa. So what did the study show? The odds ratio of having a placenta a previa, if you've had a C-section in the past compared to vaginal delivery, is 1.74 with a confidence interval of 1.62 to 1.87. So there's a 74% higher odds you're going to have a placenta previa and a subsequent pregnancy if you've had a C-section in the past compared to a vaginal delivery. And this is statistically significant because the confidence interval did not cross 1. What about a placenta accreta? Placenta accreta is a condition in where the placenta actually attaches very deeply into the uterine wall, and it's difficult for the placenta to release itself at delivery, and sometimes that can happen and result in heavy bleeding at delivery. Sometimes it can require C-section or other interventions at delivery to help with complete recovery. So placenta accreta is something that is watched very closely, and the curiosity is, are you at a higher chance of having placenta accreta if you've had a C-section before? And according to the study, the answer is yes. The odds ratio is 2.95 with a 95% confidence interval of 1.32 to 6.60. Basically, there's a 3 times higher odds of having placenta accreta and a subsequent pregnancy if you've had a C-section in the past compared to a vaginal delivery. What about a placental abruption? Placental abruption is where the placenta starts to release itself from the uterine wall a little bit early or kind of at delivery, and in that process there's significant bleeding or even a hemorrhage. This could lead to preterm contractions, preterm labor, delivery, or sometimes, if needed, a C-section to help deliver the baby in the future. The odds ratio of having a placental abruption with a previous C-section in the past is 1.38 with a 95% confidence interval of 1.27 to 1.49. You are now able to start getting this information, so that means a 30% higher odds of having a placental abruption if you've had a C-section in the past compared to having a vaginal delivery. One more thing I want to talk about is not just about the placenta, but a pregnancy complication is uterine rupture. This is a really scary, rare thing that in labor, the wall of the uterus actually ruptures. It can happen at a previous C-section scar, or if you've never had a C-section before, very, very, very rarely you can have a uterine rupture just in labor. It is a urgent situation for both mom and baby, but again, exceedingly rare. And if you've had a C-section in the past, there's a much higher chance of having a uterine rupture in labor compared to someone that's had a vaginal delivery in the past. The odds ratio is 25.81 with a 95% confidence interval of 10.98 to 60.76. So a 25 times higher chance of having uterine rupture with a subsequent pregnancy in labor if you've had a C-section in the past. Now, this is one of the things that people talk about with their doctor when they're thinking about delivering a future pregnancy is, how am I going to go into labor or maybe plan for a C-section? And you and your doctor will have the discussion about risk of uterine rupture in labor, or maybe choosing a safe place to deliver so that you could get the medical care that you need in a very quick fashion if something, which is very, very rare, does happen. So people often think about, like, can I have a VBAC, a vaginal delivery after C-section? This is one of the things that you talk to your doctor about. Now, this is a really important point in the video for me to talk about the difference between relative risk and absolute risk. The absolute risk that someone has a uterine rupture, even if they've had a C-section in the past, is less than 1%. It's 0.3 to 1.0% risk. So even though I just gave you this relative risk of 25 times higher chance of having a uterine rupture if you've had a C-section in the past, if you've had a C-section, the chance of it actually happening is less than 1%. So it's another really important thing to understand when you're interpreting statistics or kind of seeing scary numbers on an Instagram post or, medical information that's being shared. Think to yourself, is this relative risk or is this absolute risk? So the things that I'm talking about, absolute risk, whether you've had a C-section or not in the past, are very, very low. And I just want you to understand, yes, you could just say if you've had a C-section in the past, you have a higher chance of placental previa, placental abruption, placental accreta, and a uterine rupture. But the overall risk of it actually happening to you is extremely low. And I hope that that is both empowering and giving you knowledge, but without fear. What about other pregnancy outcomes like pregnancy loss? So the authors did look at relative risk or odds of having a first trimester miscarriage, ectopic pregnancy, which is a pregnancy in the fallopian tube that cannot go to term, stillbirth, which is a pregnancy after 20 weeks gestation, or perinatal death. So unfortunately passing away really soon after birth. The odds of all four of these things happening are higher if someone's had a C-section in the past. But remember that it's taking in a lot of information. So for miscarriage, their odds ratio is 1.17 with a 95% confidence interval of 1.03 to 1.32, meaning there is a 17% higher risk of having a miscarriage in a future pregnancy if you've had a C-section in the past, and it is statistically significant. Ectopic pregnancy, odds ratio 1.21 with a 95% confidence interval of 1.04 to 1.40. So a 21% relatively higher odds of having an ectopic pregnancy if you've had a C-section in the past, and it is statistically significant. What about stillbirth? The odds ratio 1.27 with a 95% confidence interval of 1.15 to 1.40. So a 27% higher odds relative risk with statistical significance. Now, perinatal death, it was not statistically significant. The odds ratio was 1.11, but the odds ratio crosses 1. The confidence interval of 95 was from 0.89 to 1.39. So it's a great example of, you could say, oh, there's 11% higher risk of perinatal death if you have a C-section than if you had a vaginal delivery in the past, but this is not statistically significant. So you have that information, but look at the whole picture. So before I move on into the next topic, let's give some context and some counseling tips. Listen, most pregnancies after a C-section in the past are healthy and do not have all of these scary complications or miscarriage, etc. But in order to answer a specific question from my patients, like, hey, if I've had a C-section in the past, do I have a higher risk of miscarriage? I can use this information to say, hey, this is what this particular study collecting information on millions of outcomes does show. So risk of miscarriage is multifactorial. It has to do with your age and your fertility history, your overall health and well-being, how you conceive. All of those things add to the equation. It's not just this one single factor, like have you had a C-section in the past or not. But if someone's asking that specific question, there is research. There are people that are trying to answer this question, and you have to take it all into context and remember that the absolute risk of any of these poor outcomes happening is very, very low. And the most likely outcome is you have a healthy delivery and beautiful baby. But we are trying to answer these medical questions with data. Topic number 3, the benefits of a C-section. I had to put something positive in there. The benefits are lower risk to maternal pelvic floor issues in the future. If you have a C-section, you have a lower risk of both urinary incontinence in the future, as well as pelvic organ prolapse. And this just means where the pelvic floor are the muscles that sort of hold everything in place, including our large intestines, our bladder, uterus, organs. And so if you have had a vaginal delivery in the past, you have a higher chance of having a weakening of the pelvic floor and kind of a lowering of these organs, pelvic organ prolapse, than if you've had a C-section in the past. So the odds ratio for urinary incontinence after C-section is 0.56, and the odds ratio of having pelvic organ prolapse is 0.29, so less than 1. So I just had to throw a positive piece of information in there because we're talking about so many negative outcomes, but I hope that I'm giving context to all of this information. Topic number 4, some rapid fire, frequently asked questions from my patients. Number 1, if I've had a C-section in the past, should I avoid getting pregnant? Answer no. Remember, most pregnancies are healthy in the future. Most pregnancies will not have these risks that we have been talking about. And so just having a C-section should not make you afraid of getting pregnant and delivering a baby in the future. Question number 2, how long should I wait to get pregnant after a C-section? There's a little bit of variation in recommendations, but most medical societies will recommend deliveries 18 months apart. And when I'm talking to my patients, I say, let's not do an intrauterine insemination or an embryo transfer until your first baby is about a year old. So that gives you a little bit of buffer. Spacing out the pregnancies gives your body time to fully recover before you are ready to go through all of the dynamic changes that need to happen for a future pregnancy. Question number 3, can I try for a VBAC? VBAC is an acronym that stands for vaginal birth after a C-section. And the answer to that question is so personal, you have got to talk to your doctor about what is right for you. There are pros and cons to laboring and trying to have a vaginal delivery after a C-section versus planning a C-section before you attempt to go into labor. And so I encourage you to ask that question and get the answer from your doctor based on your personal situation. Topic number 5, I'm glad you stuck around for this because it's important to think of 3 questions to ask your doctor about your personal situation so you can advocate for your care. Question number 1, given my history of a C-section, what am I at risk at with my future pregnancy? And is there any additional screening or things that we're going to do to look for these things like placental previa, placental abruption, etc. in my subsequent pregnancy? So does a C-section put me at risk of these things? And if so, what are we going to do to monitor my current pregnancy so both my baby and myself can be healthy? Question number 2, am I a good candidate for a VBAC, that vaginal birth after C-section? Remember, this is a very personal question. It has to do with your desires, your goals, your personal health, the reasons that you had a C-section in your first delivery or not. And great, excellent question for you and your doctor to have a thorough discussion about your personal situation. Third question, you can ask this whenever you're ready to add to your family. Ask your doctor or your provider, how long should I try before we think about getting testing? And testing can be anatomy testing, hormone testing, a semen analysis. So just nice to kind of think about. You might not want to, or it might not be recommended to try a full year before you get testing. And so have a plan, think ahead and sort of think about when you might want to get some testing, get an evaluation, and really think about adding to your family. You don't want to wish that you had asked questions sooner. I hope you found this information helpful. I really tried to teach the pros and cons of understanding statistics and really want you to learn a little bit about how to be cautious with just sort of headlines about scary outcomes. Because remember, association of 2 things like C-section with future miscarriage does not necessarily mean causation. There's so many factors that are involved in certain outcomes in the future, but we do try to answer questions that our patients ask us with the data that we have. And that's what we were going over today. If you found this valuable, be sure and like this video, comment what questions that you have, and subscribe to this channel so you don't miss my weekly videos all about reproductive health. Thank you so much for being here. And until next week, wishing you love, luck, and pineapples.